So,
So this is just to let you know that we had a slight glitch with my internet connection. So this is part 2 of our interview with Dr. Donal Collins, Wendy Budd, and myself, Debbie Cox. We just got to the point where we'd asked Donal about his journey with the low carb, high fat way of living. So we will pick up from there. Over to you, Donal.
So when I got my diagnosis, I dealt with it in the way that I would with my own patients. So the advice generally is, you're overweight, you've got type 2 diabetes, you need to eat less, move more, take the pills. So that's what I did. So I cut back on what I was eating, looked at the healthy eating plate, reduced the size of my plates, exercised more, got a bicycle, used to cycle to work, and some weight did come off, and I got a bit fitter. But what was interesting was 6 months later, I rechecked my HbA1c. So remember, that's the chronic blood sugar in my blood, and it was exactly the same, hadn't budged. So the metabolic markers had not improved, despite me doing what conventional wisdom would say you should do. So in general with life, if something isn't working, you need to revisit it and figure out why isn't it working, and am I doing something wrong? Have I listened to the wrong advice? Should I be doing something different? And during this phase, I had started listening a lot to podcasts, which I may have mentioned with Dr. Chatterjee, who also in the podcast talked to a lot of people involved in the low carb movement, which interested me a lot, and I looked into the science behind it. And the beauty of the science is it's ridiculously simple and straightforward. And often the best things in life are simple and straightforward. So in essence, if you reduce the sugars going in, your need for insulin drops, and your diabetes will improve. Really, really easy. As the conventional advice had not worked, I decided to do this approach and started putting cream in my coffee, or coffee in my cream, and cutting out rice, potatoes, flour, bread, all the nice biscuits and cakes that the patients gave me. So at work, we actually introduced a fruit bowl as well. So while fruit still has some sugars in it, it's a hell of a lot better than the cakes and biscuits that I was swallowing to a great extent before. And within the next 4 months, my HbA1c dropped 20 points.
20 points?
Oh my goodness.
Yeah. 15 kilograms just fell away without me trying. For the first time in my life, I didn't feel hungry. I started sleeping better, getting more energy, improved clarity of thought. And when I was involved in meetings, it was easier to recollect what I was supposed to remember in the meetings, rather than having to rely on lots of notes to remind myself. So mental function improved. For me a lot. The others at the meeting may not have noticed that.
I think that's probably one of the best and easiest ways I've heard it described, the way you just described it then, that the sugar, literally the less sugar you take in, the less. Do you see what I'm saying? The way you just described that, I think for most people makes it really understandable. So I think for me, it's a really good way of explaining it.
Yeah, I can agree with that. Certainly my mental focus and energy levels went through the roof very quickly. Was there any parts of the low carb, high fat diet that you found difficult, Dr. Collins?
Yes. So I can honestly admit to being a sugar addict. So I still have a very, very sweet tooth, and I loved my ice creams, and I enjoyed my cakes and biscuits, and like any good smoker who's given up, will always miss the cigarettes in the same way I do miss the cakes and biscuits and ice creams, without a doubt. So I think it would be untrue to say otherwise, but it's easier to manage. So so I'm less hungry, so the drive to reach for that pot of ice cream in the evening is significantly less. So it's easier to say no.
Interestingly, about the ice cream, that was one of my failings. It's one of the things that Wendy and I laugh about. I love ice cream. Okay, and so I had this ice cream this particular day and felt shocking afterwards, and it just wasn't worth it anymore. But a bit like you, really. Yeah, I can't say I don't miss it, but it isn't worth. It just isn't worth doing it because I don't feel great afterwards, really. So
yeah, and I think we have to recognize that for a lot of people, they just simply can't do without some carbohydrates or a bit of ice cream. So for some of my patients with type 2 diabetes, shifting from a high carbohydrate down to a low to medium sized carbohydrate diet does give them significant improvements as well. Where I think my drive was to try and fix my metabolic disorder, which meant getting rid of as much carbohydrate out of my system as I could. So for some of our patients, that will be really hard, or they will find it impossible to do. So we need to work with the individuals around that. So I think sometimes out on Twitter and in the social media places, food and diets can be really divisive, and people get very passionate on either side of the divide, whether you're a low carb or a low fat, or a vegetarian or a vegan. And we all sit within the camps where we believe we are right. But I think we all have our journey to go on, but there's no doubt if you have metabolic syndrome, you have type 2 diabetes, you can either try and treat yourself with medications, or you reduce the carbohydrates going in.
So how did you adapt your diet? Tell us, in a sort of a typical day, the changes that you made from sort of normal Western standard American diet to the lower carbohydrate diet. What changes did you make?
So what I was having before would be what I would have called a healthy diet, but clearly wasn't healthy because I was significantly overweight. So I'd have a nice big bowl of porridge in the morning to make sure I didn't get hungry, even though typically at about 11:30 I was ravenous. So I would have a nice healthy brown bread sandwich at lunchtime, with plenty of salad in it. And I'm an omnivore, so I would have had either beef or ham in it. And again, would typically get hungry again around 3 or 4, so grab a biscuit, cake, whatever was around the surgery. And again in the evening, have some nice brown rice dish with a curry in the evening. And then before going to bed, of course, swallow it down with a half a tub of ice cream. So that would be my standard diet beforehand. And the switch then was to say, right, if I need to get rid of these and I need to get rid of my hunger, I learned that I needed to significantly up my fat intake. So that's where the cream, double cream, and the coffee came. And much to my surprise, actually, that kept the hunger away, and I was easily able to last until lunchtime. And then at lunchtime, again, I would either have chicken that I would have cooked the night before, or leftover dinner with a salad. So typically green leafy veggies or even spinach, and a bit of cheese. Might melt that in the microwave. And then that would get me through to the evening. And then in the evening, at typically about 7 o'clock, have something with perhaps eggs. So a good meal that we enjoy cooking at home now is a frittata, which will have about 7 eggs, a half a tub of cream in it, fry some bacon in a pan, some sour cream and creme fraiche, mix that all together and bake it with some cheese on top of it in the oven. It's absolutely gorgeous. It's a favorite of my daughter, so she bakes that regularly for me, and really enjoy coming home to that.
I think
that's really important with the diet, is that I can honestly say I don't feel that I'm missing out, and the food that I eat is absolutely delicious. I don't feel like I'm on a diet at all. Would you agree with that, Debbie?
Yeah,
absolutely. Yeah, I do. I eat. I've always eaten pretty well. But the food that I eat now tastes better than it's ever tasted. So that's one of the reasons I find I like food. I do. So the fact that I'm now eating nicer flavoured food, I've got more adventurous with flavours and spices and herbs and those kind of things. But the meals that we're now having, they are so much better than we were having before. So yeah, not a problem to keep on the diet. How about you, Donal?
I'm really enjoying my food. I remember when I read some of the books on low carb, they talked about that your taste would change as time went on, and I found that hard to understand, but I can appreciate what they are saying. So I think while I was I was eating and enjoying my food before, but I wasn't really feeling satisfied when finished my food. I am certainly really enjoying my food now and feeling quite satisfied. So I'm eating to live now, not live to
I think that's a critical difference, isn't it? You mentioned, Donal, yourself being a sugar addict, and we kind of joke about sugar addicts, but do you think that actually there is such a thing as sugar or carbohydrate addiction?
I have no doubt. So I think most people who would have ended up in the situation I was in will recognize the munchies you get at night time. So shortly before bed, sudden craving comes on, and when that craving comes on, you don't reach out for a bag of spinach or a bag of broccoli. It's always the biscuits, the crisps, or the ice cream. And why is that? Why do you reach out for those things? So and again, your mind always searches and reaches for it, and you get instant gratification. And as time goes by, the gratification gets less and less, and you keep searching for that fantastic hit that you get. So it ticks all the boxes of addiction.
I think that's absolutely so. I think I was without a doubt a sugar addict, and I feel probably had been nearly all my life. Certainly it probably is the first addiction, isn't it? That there's a lot of an emotional reliance on food. If we celebrate, it's with a cake. If you have a bad day, you're given ice cream. So I think it's an emotional crutch as well.
Yeah, I think so as well. Even with the children, you are right, Wendy. That like you said, if they've had a bad day, it's like we'll go and have and I know with my own children, I did this. I'd go and say, well, we'll go to the cafe and have a nice cake or something, and try and. So yeah, I know that certainly for me, I've done it that way. Unwittingly, I would add, but yeah, that's what I was doing. So the other thing I would say on the food side of things, that interestingly you said about your daughter, Donal, that I find that my children, or my son that's at home with me, he's very, very happy to eat the food that we're eating. And so I think one of my first concerns was, would he be willing to partake? Otherwise, would it become complicated cooking different dinners? And the reality is he loves the food that we eat. So that hasn't been a thing that has really been a problem at all. He's actually really enjoyed the food, rather than it being, I don't want what you're eating, I want, for example, a pizza. We'll use that as a best example. He will eat a pizza, but we will now eat a fathead pizza, and he prefers that than a normal pizza. So again, I think there is this, sometimes there's a bit of an illusion that the children aren't going to eat it. That's not what I found, actually. There are some things maybe he's not quite so willing to eat, like liver and bacon casserole. Maybe that's one he won't eat, but apart from that, he'll eat everything else. So again, he knows and he can see that he's getting good nutrition as well. So yeah, it's good.
And the key is the environment, isn't it? So the environment we live in, if it's a good environment, it's easier to manage with this lifestyle, and the environment around us. So I was involved in a project just before COVID came in, working with some of the schools in Gosport, trying to research some of the data of our population health, and to look at the environment in Gosport to say, is this a healthy environment? So when you look down the high street, how easy would it be for you to find a lunch that is low in carbohydrate, and lunch that is nutritious and healthy? And it's really, really hard. And equally, if you are hungry in your car and on the move, how easy is it to get a nutritious, healthy snack or small bite to eat to get you through the day in the garage?
Yeah.
Or in some well-known coffee shops. So if you go into a coffee shop and look in the windows, it's all heavily laden with carbohydrates. So we keep talking about choice. So I don't have a choice when I go to these places other than just having coffee and nothing else.
Yeah. One of the things that Wendy taught me very beautifully when we first started this journey, Wendy would be eating a nice cooked breakfast, and she was very brave at saying to the cafe owner, "I don't want the hash browns. I don't want the beans. I don't want the bread, thank you. But can I please have an avocado?" And I watched aghast that she asked these things, because I was terribly British about the whole thing, and I wouldn't ask to go off menu. So Wendy got this beautiful breakfast. I do the same now. So when I go in, I'm much more not cheeky. It's not even the right word. Assertive is the word. And I just say, can we just swap these things up? And sometimes they will say yes, but for a slightly extra price. But actually, that's okay. But I've got braver at asking for alternatives when I'm going out. But you are right. I think there's a very limited choice sometimes, especially in garages and that kind of thing. It really is just lots of carbs. So I think that's more difficult than some of the cafes. So any more questions that we'd like to ask Dr. Donal Collins, Wendy?
Could you explain to us why a high-fat diet increases your satiety so you feel fuller for longer?
Okay, so in our gut we have many, many hormones, and we have some hormones that effectively tell your brain you are full. But if your insulin levels are chronically raised, they block those hormones.
Right.
Okay, so particularly when in the situation I was in with type 2 diabetes, I would have had a very high insulin level, which in turn would have blocked the hormones coming from my tummy to tell my brain, you're full, you don't need to eat anymore. The effect of those are dampened down and blocked by hyperinsulinemia, which means very high insulin levels. So what I noticed over the last 15, 20 years, when I sat at a table with some of my colleagues and I had the same plate they had, they were full and didn't need to eat more. At the end of the plate, I was still starving, right? And I would have been looking at whatever was left on their plates thinking, gosh, I'd love to be able to grab whatever was left on their plate because I'm still really, really hungry. And I think what happens is if you reduce your carbohydrate intake, that means your body does not need insulin to pack it away. Your insulin levels come down. And then those hormones that give you that sensation of satiety and fullness can effectively work. So you will feel full when you're supposed to be full. And that sense of fullness will last longer.
So interesting and so simple as well. It makes a lot of sense.
And again, the best things in life are simple. We make things really complicated when we don't come up with the right answers or explanations, and sometimes we make it even more complicated when we start off a path of saying it is healthy to eat a low-fat diet, therefore I'm going to keep on doing the research until the numbers tell me I am right. It's interesting when you look at the research over the years, the evidence was never there.
No.
It was never there, but it's really, really hard to turn around and get big organizations to say, you know what, we might have got this wrong over the last 30, 40 years.
I think that's really key, and certainly Zoe Harcum says exactly that. She says that people don't like to admit that they're wrong.
Well, certainly in my industry. So if you look at people like me, so typically I would have done well at school. So typically I tend to get things right a lot. So I do exams, I pass them. I then go to medical school, I do a lot more exams, I pass them. You then come out as a junior doctor and you're faced with yet more exams. So for about 15, 20 years of my life, I have been trained that I must get things right. I've never been trained on what to do when I get things wrong. So that makes me feel really, really uncomfortable. And it's not a place that naturally sits with me. So that's why I think the concept of learning from failure is really, really important. And we need to encourage medical students to fail early, learn from failure, fail frequently, and say it's okay to fail, because that's the human condition. We fail a lot.
I think that's really succinctly put. And as a medical herbalist, I would say that when people come to see me, generally, one of my jobs is to demystify the medical jargon, if you like, for my patients. And that in itself can be really life-changing, because if you can explain things in layman's terms, it makes it so much easier for your patient to make the changes that are required. Whereas I think sometimes, because the medical profession has its own language, it has its medi-speak, I think perhaps doctors don't realise that people don't quite understand what they're saying.
No, absolutely right. And I guess we get used to using big words or words that we're comfortable with, and we assume people know what they mean when they don't, and we're not good at checking. Do you understand what I've said? And asking people to repeat it. So, if I think I have explained it, then getting the patient to repeat what I think I have said in a way that they're able to understand can help. So what I'm going to do now, I'm just quickly going to share the screen, if that's okay. But I need Debbie to give me permission.
Yep, just done. Yep.
Okay, let's see. And again, this is about learning from failure. So I think a lot of these things we've been talking about, we've known for a long, long time. So I don't know if you can see that, but this is from the Egyptians. So the Egyptians knew about heart disease some 4,000 years ago. And you can see here in this papyrus, they talked about chest pain. And if you got a pain going down your arms and your breast and the side of your stomach, it's not good news. And interestingly enough, there we go. They were suggesting there's some herbal remedies they'll be able to take, but certainly death is not far away. What they were talking about. And when we look at modern Egyptians, it was really interesting. So there was a study here by the Horace group, which includes people from Egypt, from the States, from natural history and medical background. So it's a really interesting bunch of people who looked at atherosclerosis in modern society and in the Egyptians. Okay, so here are the Egyptians who lived 4,000 years ago, the mummies. There wasn't cigarettes around then, so we can't blame cigarettes for the vascular disease. Mm-hmm. They didn't have public transport or cars, so they were pretty active. And we think they had a fairly healthy diet and lifestyle. But when you look at the vascular disease, it was shocking. So these people typically died in their 40s and 50s. And if you look up here, so the dark color is the modern Egyptian patients, and the red color is the Egyptian mummies. And they measure this by doing CT scans on the mummies and measuring the calcification within blood vessels, which gives you a good indication of disease. So people under the age of between 30 and 40, look at that, so 40% had vascular disease in the mummies. If 40 to 50, over half of them had. And then interestingly, once you got above the age of 50, so I'm assuming here they either died from the vascular disease or society was kind of a violent society back then. So maybe you died from getting a spear in your back or something. But so this is at a time when there wasn't cigarettes. We were taking exercise. We were eating healthy nutrition. And yet we had a vast amount of cardiovascular disease. And we think that this is a modern Western disease.
Okay.
So maybe...
Of course, the Egyptians ate huge amounts of grain. They were known as the bread eaters, weren't they?
Exactly that. So again, it comes down to what did they actually eat. So there was one theory that well, these mummies must have been wealthy, so they were the meat eaters, and they got blood vessel disease, which was an assumption in one paper. So this paper shows that they looked at some isotope studies from carbon-13-14 and from nitrogen, and essentially between the differences of that, you can tell fairly accurately what sort of diet they had. So this is a paper from Truzzo et al. In 2014, so not so long ago. And this was the outcome. So rather than being big meat eaters, they substantially were eggs, milk, and mostly vegetarian diet. Oops, sorry, I have one thing there. And the meat consumption was around 20%.
Well, that is incredibly shocking, isn't it? You would assume it would be the opposite.
Yeah.
Exactly that. So what is interesting is it's not far off that.
Right, okay, yeah.
All right, and this is what we're supposed to be eating these days. So again, learning from the past, I think we've got a long history of not learning about stuff that went on in the past and bringing it forward. So the Egyptians, who had significant cardiovascular disease, ate what we are advocating that we should be eating now, which is interesting. And you know, over history, we have lots of evidence of it's really hard to change. So vitamin C is a great story from Gosport as well. So in Gosport, vitamin C we proved that vitamin C cures scurvy. Famous officer in the Navy, Surgeon Commander Lind, did a trial in the Navy that proved it. And that was back in the early 1700s. But how long did it take for the British Navy to use this as a standard operating procedure? So here's a substance that stopped scurvy, which had a 50% mortality on board ships, worse than any battle they were ever in. How long did it take to make sure every sailor had vitamin C on a regular basis?
No idea.
So from Lind's paper, it took about 55 years for that to happen. But then when you look into the research, actually in 1601, a guy called Surgeon Captain Lancaster also proved it by giving people, it was 4 spoons of lemon juice as well. So it actually took 250 years.
Oh, my goodness.
So as humans, we're not good at looking at the evidence, adapting and changing. And there's an interesting book out about diffusion of innovation. So when you get good ideas, it's really, really hard for us to take them on board and adapt and change. So one good example is your keyboard. So I know we're going slightly off the topic of diet, but it's really important to understand these things so we understand why it's hard to change. So your keyboard, the QWERTY keyboard, do you know why it's designed that way?
No.
Okay, so it was designed at the turn of the century to slow you down. So all the keys are in the wrong place. And in the 1900s, you had mechanical keyboards, and if you hit the two of them together at the same time, it would jam. And this was causing huge inefficiencies. So QWERTY came along to slow the typist down so that no two arms would ever lock and jam at the same time, and effectively sped up typing. But with the onset of computers, modern keyboards, and not having the old-fashioned mechanical keyboard, there wasn't a need for that anymore. So in the 40s, there was a keyboard called the Dvorak keyboard developed, where all the keys are in the right place, and you will type 25% faster. And you can change it by going into your system settings and saying, please change my keyboard to a Dvorak keyboard, and put some stickers on all your letters.
Wow.
So now that you know that, will you do it?
No.
No, you're right, actually.
You now know something that will improve your life, speed up your efficiencies, give you better outcomes, and you're saying, no, I don't want to do that. So the next time we give health advice to somebody and we can't understand why they won't take it from us, think of your QWERTY keyboard, and change is really, really hard.
Yes.
Yeah, okay, that's a really good.
Well, this is why I think we feel so strongly about educating people about the low carb, high fat way of life. And I know we can all agree here, certainly, that education is key.
Yeah.
And it's something that I know yourself, you believe as well, Donal.
So I've given advice to about 100 of my patients. For the first time in my career, I've started recording diabetes in remission on my patients, which was something I didn't know I was able to do 5-10 years ago. And I think of the 100 I have advised, there's probably been about 5 or 6 who just could not give up their ice cream, biscuits and cakes. And they just said, this is not for me, and that's fine. So this is where informed choice and decision making comes in. But for the vast majority, blood sugars have come down. Need for medication has reduced. I've got one guy who's an interesting chap who actually has type 2 diabetes but is very thin, so isn't the traditional type 2 diabetic, and is on insulin. And his requirements for insulin have reduced from 100 units a day down to 40 units a day. And his episodes of hypoglycemia have, interestingly, significantly reduced. So he feels more in control, haven't got him off the insulin, but he is happier, feels better, improved mental clarity, and less episodes of hypoglycemia.
That's wonderful.
Yeah, it's good. Yeah, really good.
But so I think the key, if you're going to do this sort of diet, is if you're on medication, you need to get advice.
Yeah.
Because if you're on medication that drops your blood sugars and you don't adjust them, your blood sugars may precipitously come down, and then you might have a hypoglycemic attack, which means very low blood sugars, which means you could pass out. Also, interestingly, if you adopt this lifestyle, blood pressure can drop. You can lose quite a little bit of fluid. So if you're on blood pressure medications as well, it's worthwhile getting a blood pressure monitor and check your blood pressures. And if your blood pressure readings come down, it might be worthwhile talking to your GP about adjusting your blood pressure medications.
Oh, really, really, yeah, really good information. Thank you so much for your time this morning. I'm hoping this has just demystified a lot of the questions that are commonly asked about this way of eating. And I think you put it really, really well in a really simple format. So hopefully people can understand really what me and Wendy have been going on about for for a while now. We're not just keto warriors. There are very good reasons why we're doing what we're trying to do. So thank you very much for your time this morning. We really do appreciate it. Thank you.
Great fun. Take care.
Take care. Thank you. Bye.
Bye.
Bye.